Hello, my name is Brian Wilson from Catalyst Physical Therapy and Wellness, and today I'm going to be taking you through a progression of exercises that are important for people that battle with chronic lower back pain. These exercises are going to be done in standing, and it's going to be based upon the idea of trying to bring more motion to areas of your body that will decompress or make the tissue around your lower spine release and feel better. The big thing that we want to think about is throughout our day we often do a lot of things that involve forward flexed positioning, involve seated positioning where you're really rounding that spine, or even just kind of driving for long periods of time, and bending, picking up things off the ground. All those things add up throughout the day, and they can increase a lot of force across that back. So the idea behind these exercises are really trying to bring the hips and the thoracic spine, that mid part of your back, and those shoulders, kind of awaken them so you can liven up those areas so they take the pressure away from this lower part of your back. So you might be utilizing these exercises throughout your day at work. If maybe you do sports that have a lot of more demand and they put a lot of pressure across that back when you're doing those sports. So you can do this in your gym routine before you lift, CrossFit, whatever, or even bring it into the warm-up routine that you do before you go into sporting stuff. So the idea is, again, just you don't need a lot of materials. We're going to use a chair today, a little rolled-up towel or a book to post our feet, and then we're also going to mimic what we would do in a doorway. So I'm going to ask my friend here, Paul, to come over, and he's going to demonstrate a lot of these exercises for you while I walk you through them. The first thing we're going to do is set up our doorway. So I'm going to use this pole here. If you don't have an area that you can actually get a good grasp on something, you can use the wall and just do a lot of this stuff up against the wall. But for most of the people that we prescribe these exercises, we always tell them to do it in their doorway. So the first exercise he's going to do is involving his pec. I'm going to hold the pole here, and this would be done in the doorway. He can come at the lower height or the middle height. But the idea is he's going to stretch out that tissue in the front of his left pec here, and he's going to be working into just kind of driving that lunge a little bit forward, going in and out of that stretch. Good. He's going to do that about 10 times, holding it for a couple seconds in that end range. He can do that 15 times if it feels good, whatever really feels good. But the idea here is he's just kind of starting to work his body forward and begin to load that tissue in the front of his chest that kind of keeps him from rounding his shoulders and rolling more forward posturally. After he's done that straight head direction, he's going to work into the side-to-side direction known as the frontal plane, and he's going to begin to move his hips side to side while he's in that stretch. So he can hold the stretch and then do, say, 5 to 10 different drives with his hips to begin to move that into the frontal plane. And then he'll work into a transverse plane, more of a rotational component to it, and really roll away. Looks a lot like a pitcher at this point when he gets back into that big rotational angle. Excellent. Really opening up that chest, getting a good stretch. And that'll kind of take care of that chest and pec and begin to take some pressure off, feeling like he has to round his shoulders all the time. All right, next thing is going to be he's going to stretch the lats. The lats have a direct attachment to that lumbar spine and those lower thoracic, that mid part of your back. So this stretch, he's going to begin to start off again in that stretch, just sitting back, trying to feel a stretch on his right shoulder right now. He should be getting that all the way down the rib cage, sometimes into those lower back joints. But he doesn't want to feel any sharp pain. You just want to feel a gradual stretch throughout that whole area. And then he's going to work in that straight ahead direction first, kind of sinking lower, squatting lower and lower towards the ground. Good. Excellent. And then he's going to work into more of a seated, there he goes, loading up the lat and then sitting side to side a little bit. When he comes towards this way, as he's coming towards the camera there, he's going to feel a little bit more stretch into that armpit. Good, and coming back. And then he can rotate, taking his hand and reach underneath this to really wind up that lat in that rotational plane, transverse plane, getting a good motion there. Awesome job, Paul. All right. You do that on both sides, obviously, or if one side it feels a little bit better than the other, stay there a little longer. The final thing he's going to do for his shoulders is going to be a posterior cuff stretch where he's actually going to turn his body facing the camera. Great. And at this point in time, he's stretching that right shoulder, getting a good stretch to the back side of the shoulder. And he's just going to start with a lunge again, straight ahead, just kind of going forward and back, getting deep into that stretch. Excellent. And if it's hurting up in your neck or anything, you can keep your eyes a little bit more pointed in this direction. But the idea is to begin to loosen up that shoulder on the back side. And then from there, he's going to hold that stretch and then start shifting his hips to the right, to the left, that frontal plane. Good work. Excellent. And then he's going to rotate a little bit deeper into it. Good. And then really wind up. Notice how he's using his pelvis here. He's turning that pelvis to the right as he gets out of that and really rotates into that stretch. You don't have to take as big of a lunge as he's taking. You can just get into this position and just really, small motion is fine. You just need to make sure that you're getting it in the right area of the shoulder. You're not feeling any pinching in the front of the shoulder, and it's going to that tissue to the backside. All right. That kind of takes care of the upper part of the back, getting him loose there through the shoulders, and we'll do an exercise in a second that continues to enhance that. But the next thing we're going to do is we're going to get him into a calf stretch. So we're going to start from the ground up now, and I'm going to put a little towel roll. You can use a dumbbell, a towel roll, a book, whatever you need. But he's just going to step that, keep those toes pointed upward, and take his opposite leg and begin to get into that lunge position where he's stretching out the tissue along the backside of his calf here. So he's just, again, going to pulse forward and back, kind of driving into that motion. Awesome. And then once he gets there, and after he's done that, say 5 to 10 times, and begin to really start to feel this muscle release, he's going to work into that side-to-side motion. Oh, there you go. Making sure he gets both muscle bellies to this gastroc. Nice and stretched. So using the frontal plane. And then he's going to work on rotating and rotating. Awesome. So going left, right rotation, driving from that. Very good. The whole time beginning to try to really feel the stretch here across the back of his leg. Because believe it or not, if your calves aren't loose, that early rolling forward of your foot can actually cause more hip flexion, which then can increase that lordosis in your back, causing more lower back strain. So that's why I'm going all the way down to his foot to get loose. The second thing we're going to do is we're going to get up to his hip, the hip flexor, the most known culprit of lower back pain. So in this position, he's just going to take one foot up on top of the chair and stretch your right so they can get a good show. Good. And he's keeping both feet straight ahead here. What a lot of people will want to do is just let this foot kind of rotate out real quick. A lot of people will let that foot roll out like that. But you want to really watch that and not allow that foot to roll out, because you're going to then unload the tissue that you really want to get stretched. So for the sake of getting that hip flexor stretched, you need to keep that toe straight ahead, or at least work it towards that straight ahead angle and try your best to keep it in, because that'll at least begin to get that tissue stretch that needs to happen. He's going to keep his hands on his hips at this point. He can draw in his belly button a little bit, making sure that he's going forward, feeling that pull all down the front of his right thigh, usually a little bit higher up in the hip than what would you feel if you were doing a quad stretch. And we can also bring in the 3 planes of motion to this. So going side to side, good. So now he's just shifting his hips to the left, to the right. But again, he's wound up the tissue first, gone as far as he can forward, and then he starts to move his hips right and left. So make sure you take that time to really get that area addressed. Then the final one will be rotating away, great, and towards that tight hip flexor, really trying to enhance that. One little trick of the trade, if you feel this stretch all down here and you don't feel it in the right front of the spot, or right front of your hip, you can actually take a towel, place it under your heel, and that'll kind of take that tight calf and unload that and begin to get the stretch a little bit higher up. So you might see the motion that he's gained just in doing that, because he's taking his calf and he's unloading that. So another little important adaptation you can do. All right, so that takes care of the hip flexor, which we know has a direct attachment to that lumbar spine, so another big one to do. And then we're going to work into our adductors, which is the groin muscles. So all he does different from the hip flexor is he takes his foot and he rotates it out about a 90-degree angle from his opposite foot. And we're going to be stretching the right groin muscles now. And he's just going to begin again to go straight ahead. And what he wants to feel is a pull down that inside of his right thigh. If you feel any pain in your back at all during this, you don't want to go ahead and push into that. You want to bail out of that. You want to actually try to go away from any type of pain in the spine or in the joints. You want to make sure you're just waking up the muscles in your hips during these exercises. All right, so say he did about 5 to 10 of those as well. Then he could work into that going forward, getting that tissue loaded up, and then working a little bit of rotation to the right, rotation to the left. Good. Excellent. He could even kind of shift his hips forward and back a little from this position. Good. Ringing out that way. And we've already driven into that frontal plane a lot as well. So he's moved into that position for the adductors. Okay, moving along from that. The final stretch for the hips that we're going to work on is going to be for the IT band. And we're just really going to stretch the outside of the hip here. So what he's going to do is he's just going to take one foot, cross it over the other, and he's just going to begin to push his hip to the outside there. That left hip's going to translate out the outside. And this is going to just in general stretch the left side of his hip and that little bit of from Mayfield up near his rib cage. Could feel it down along the outside of the lateral part of his thigh. But he's going in and out of that stretch as well. Sometimes people like to, what I do is tell them is, why don't you bend your chest a little bit forward and let it roll there. That might go more into the backside tissue there, get into his glute a little bit more. Or even take and drive your hip back a little more, and you can get closer up into that front side tissue there. Both those areas have muscle that attaches to that IT band, and really the whole goal of this exercise is to begin to loosen up those muscles that do attach to the IT band so it doesn't transmit forces either down towards the knee, but more importantly up towards that back and holding his pelvis in one position. Perfect. So he's done those. He's got his hips feeling pretty loose. The only one we didn't talk about in this video in particular is the piriformis stretch, but we do that in our seated spine exercises, so you can watch that video if you're interested in learning more about the piriformis. The final couple exercises I want to teach you are more along the lines of after you've gotten the tissue loose, you begin to exercise. And what he's going to do is he's just going to do some pelvic tilts, or what you a lot of hear is that kind of tucking position. He's going to actually work in 3 planes, though. He's going to roll forward into a squat, come back, and let himself go naturally into that posterior tilt. So rolling his pelvis forward, coming back, rolling his pelvis forward, coming back. If this feels painful at all directly in your spine, just take your hands, rest them across your lumbar spine as you go into that back position. And again, you can still get the same motion, but support the spine a little bit and ask those hips to do the movement and that pelvis to do the movement. Good. Now facing the camera, he's going to show you what a side-to-side tweak on this one would be. So he kind of gets those knees locked out and he's going side right, side left. Excellent. Again, just asking those hips to begin to start to do the movement, not trying to feel any pain in the back. If you do feel specific pain in the back, only go the direction that goes away from that pain, and then kind of gradually work your way to the other side. Final direction will be that rotational transverse plane, rotating to the left, excellent, rotating to the right, perfect. So he can work through this again, 5 to 10 reps, just getting loose. If you feel one area that feels a little more tight, stay in that area and drive into that consistently. And then we'll bring the shoulders back into play now, and he's going to start doing some punching. But he's going to be reaching up to the ceiling and telling the shoulders to drive the motion. So the idea is to actually take that arm, and why don't we show him from this angle first? Step back just a little bit for me here. Perfect. And then you're going to reach straight ahead. Great. Excellent. And this is that sagittal plane, that forward motion. A lot of people are familiar with this direction. But now let's reach behind your back. Excellent. Good. And now he's really reaching and getting those shoulders to drive the motion throughout that thoracic spine, drive the motion through his hips, getting more into extension. Doing an excellent job. Now you can face the camera and we're going into that frontal plane. And he's going to do some reaching to the left. Great. To the right. There you go. Excellent. We'll work for about 5 to 10 of these as well. For the sake of time, I'm just going to have him do a few. You can add dumbbells to these to really make it into a drive and get a little bit more force. Go ahead and reach now overhead, that opposite. Great. Now he's working that side bend, really getting a stretch to that side wall. His right side there, his left side there. Excellent. And then our final direction will be transverse plane, reaching across his body in front. Good. And notice how he's not keeping his hips nice and still. He's rolling those hips, and he's trying to get them incorporated into the exercise. The goal here is not to isolate into your lumbar spine, but to ask the areas around it to start to move better. Good. All right, now let's open up into some back reaches into that transverse plane. Great. Very nice. And again, make this with dumbbells. Make it a little bit more if you're trying to progress and get into some heavier weights. Nothing says you can't add weight to this exercise. It actually teaches you more how to stabilize in those positions than just work on mobility. All right. And the final thing I'm going to bring the chair back out for is going to be the traditional type that everybody wants to hear about, the plank when they're working on their core. But we're going to take it and we're going to tweak in the 3 dimensions. So I'm going to have him begin to get into that just nice, good position where he's actually rolling his pelvis more into what is considered to be a neutral position. So his core is working really hard at this point. And if you can't handle this low of a height, just work your way to the wall. You can do it at a table height, whatever feels best for you, but the idea is to challenge your core. So at this point in time, he's holding it pretty static. Now why don't we just add in a little of that motion to it? So just controlling, coming back out of it, good, and going deeper into the motion. Controlling it though, not feeling any pressure in his lumbar spine. Really just asking those abs to turn on and slow that motion down. Excellent. Good. Now we're going to go a little bit more side to side. Very good. He's in that really deep position right now, so he's stressing out in those abs, trying to work into that good controlled plank, but he's now tweaking the hips and going side to side. Very good. And then we'll do a transverse plane rotational movement. Very good. Winding up. Now he's bringing those obliques into it a little bit more and really asking those guys to control that motion, because gravity is fighting him right now and causing that lumbar spine to try to want to cave, but he's trying to really hold those abs in and not allow it to get too curved. Okay? So thanks, Paul. That does a great job. And these exercises are just a starting point for most people. But once you've taken these exercises and began to progress them into a level that you feel is challenging, you're always, welcome to try to come in and see us over at Catalyst Physical Therapy. We do a lot of custom individualized exercise programs for people just to try to enhance themselves and teach them how to move in the right areas, but not only move in right areas and challenge those right areas of the body, but try to find the source of all their dysfunction. So when you have pressures in the lower spine, it's often not the back's fault. It just is a lot of times tied into those hips and that upper thoracic spine. So if you feel like it's going one way, and one side in particular, really seek out that specialist here at Catalyst and we'll be able to help you out along the way. Thanks.